How confident are you working with clients who want help turning their breech position babies? Do you have clients who want to try and deliver vaginally even though their baby is breech? Over the past few months, in preparation for the Birth Healing Summit, I've been learning a lot about breech birth. And in today's podcast, I share the highlights of what I've learned and I talk about what we can do as body workers, PTs, and OTs to help clients with breech babies. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hi, everybody. Welcome to this episode. And today I'd like to talk to you about breech birth. It's really been on my mind because I did 3 interviews for the summit this year, all on breech birth. And I just think that it's something that we as practitioners need to be aware of and know that we can help a baby that may be stuck in a breech position to find more space and to be able to turn if it so chooses. So, breech is something that is pretty common, and I think 4% of the births are, babies are breech. And Dr. Nathan Riley and I talked in the summit about breech birth kind of being like the state of birth today, and that there's so much fear around breech birth. And really, Dr. Hall and I did an interview, and he's a doctor here in the Denver area who has been delivering breech births for the last 4 decades. And, his comment is that it was what I was taught. He was taught how to deliver breech babies, and it's just another presentation of normal that he was doing in his residency. And then there was one research paper that came out that said it was dangerous. And he says that in 4 months, boom, everybody shut down. Nobody was delivering breech births anymore, except for he continued to do it because to him it was just another normal presentation. And it's for me, it's so frustrating because Dr. Hall actually shared a couple of videos of babies being born breech. And really, you have to know what is abnormal. You have to know what to do in a funky presentation of the baby. But when baby comes in a proper position, which there's signs for you to look at and know, there's absolutely nothing for the provider to do. And I think that is just so goes against what most providers in the hospital know is they have to intervene, they have to be there, they have to manipulate, they have to do something. When all reality is that birth is such a natural process that babies should be able to be born without any interventions. And the same goes for breech birth, that when babies come out, in fact, what can make a breech birth worse is if they do touch the baby. If baby comes on out and it comes out butt first and then the feet flip down, we want to not touch the baby, because if the provider does touch the baby goes into a startle reflex, which extends the head, and then that can cause the chin to get stuck on the pubic bone. But there's just a simple maneuver that practitioners could do to help tuck the chin to allow baby to come on out. And so I'm just so sad after watching and doing these interviews, this summit. I'm just so sad that it's not a more natural process that hospitals are more willing to allow happen for women, because it really isn't that much different than a vaginal birth when it comes to helping the baby come on out, which is hands off, keep your hands off the baby and just allow the baby to do what it wants to do. And Dr. Hall really went on to talk more about the resuscitation of a baby after birth and how hospitals are actually interfering with that process as well. And he's really had to train his team to just stimulate baby and just allow baby to gasp and increase the carbon dioxide in its system, which then kicks in the breath, the breathing for the little babe. So you've got to watch these videos that he shares with us in the summit because it looks so easy. And Dr. Riley even confirmed that it is a pretty simple procedure, but yet there's so much fear wrapped around a baby coming out. But it's really not as scary as it should be. You just need to have a practitioner that feels comfortable birthing a breech birth. So hopefully over time we will get those practitioners to become more comfortable and we can help shift the tide to allow more vaginal breech births because if you watch the summit and you watch these interviews, it's not that challenging of a birth, I guess, unless something is going wrong, then you really need to know what to do. So the other interview that I did for the summit was with Jamie Mossy and Nicole Miranda Morales, and they wrote a book called Breech Release. Excellent resource for you if you're interested in understanding more about how to help babies potentially turn. And it's something that I want everyone who does body work on pregnant people to be able to be aware of what needs to happen there. And really, we've got to be okay with palpating baby's position in the body. So you got to understand the difference between what is a head and what is a butt, and understanding where the kicks and the wiggles are. That gives you a sense of where the feet are and the hands, and really getting a sense of where the baby is. And the other key piece when you're working with breech positioned babies, is we also want to understand where the placenta is. And if you're not quite sure where the placenta is, I would I would hold off on doing any body work or doing any trying to make the baby turn. So we can continue to do the release work that hopefully you know how to release the round ligaments, the uterosacral ligaments, lower abdominal fascia. Those are all techniques that we can still do when we have a breech presented baby, but I wouldn't do the inversions and the techniques to try to help a baby turn unless you know exactly where that placenta is. Because if you're trying to get a baby to turn where the placenta is, it's not going to go, because babies know that's their lifeline and they will avoid the placenta at all costs because that could compromise their supply of blood and food and nutrients. So they know how to stay away from that. But key areas of the body to really work on when we have a breech presentation is the rib cage and the diaphragm. And also in the interview, Jamie and Nicole talk about that the right baby being on the right hand side of the rib cage with the head being stuck up in the right hand side of the rib cage is the most common presentation. And of the few breech presentations that I have encountered in my practice, I have seen that as well. So that's very, very common. And I think if we have a transverse baby in there, we really need to be looking at the round ligaments and knowing how to release those round ligaments. And there is a technique that I went and took Jamie and Nicole's breech release course, and it was great. It was they have a four pathways to help a baby turn. And it's very trauma informed care, which I love. And they teach an ironing board inversion of the mama, and working with the pregnant person client in that position really does help lift baby more into the diaphragm, which allows you to be able to get in there more and make greater releases. And so I am including that in working on the inversion in the ironing board, showing you how to get your clients on and off that, and some of the techniques that we can do in that position in my new pregnancy course that will launch May 4th or 5th, I believe. And it will start on the 19th of May. And I am excited to share that with you In this new course, I'm going to be addressing the breech presentations and what we can do about it. I'll also be talking about babies' presentations beyond breech. So if we have a high head, we have a off-centered head, what we should be looking at and what we should be releasing. I'm also including in this course how to work with the fascial chains in the body. So working in side lying and supine, how to work with the adductor and tailbone connection in the body. There's a great release that I teach in as well in there. So this is a more of an introductory pregnancy course that goes over pregnancy basics, labor basics that I don't cover in my holistic pregnancy course. And so I'm covering it in this. And then also some more superficial techniques working with the fascia and the muscles and with and breech presentation. So it's going to be a great complement to the holistic treatment of the pregnant body course. And so just wanted to let you know that that is coming up in early May. We'll be opening the doors for that new course. It'll be delivered as a cohort. So you'll get a couple of group calls with me when you choose to join in with this course. And we'll be announcing more about it in the next coming weeks. Excuse me there. And so I just want everybody listening in to get more curious with breech presentations, know that we can make some effective changes in the tissues. Not every baby, though, is meant to turn. So that's something else we need to keep in mind, is that I've been successful with a couple of babies, helping them to turn, but there's a couple that have not turned, and we did really beautiful work in the physicality of the breech presentation and also the energetics of and releasing the birth trauma from this one client with this one client. And I never did hear if baby turned. So I'm assuming that baby chose to stay breech. And we just really encourage mom to know that it's baby's choice. Another interview in the summit this year is Geneva Montano and I talk about, it's really baby's birth, and that we need to be okay with whatever baby chooses because there's a reason baby's choosing it. So we need to be okay. Baby may be choosing a cesarean birth for reasons that we do not know. And so we can help our clients release the physical, the energetic, the emotional restrictions that may be causing babe not to want to go head down. But in the end, it's really up to baby. So we have to help our moms to realize that I never tell anybody that I'm going to turn their baby. What I do tell them is that I'm going to create space and balance in their tissues that will hopefully offer the option for baby to turn if it chooses so. So please keep that in mind and know that our job is not to turn baby. Our job is to give baby the option to by creating space and balance in the mom's body. And if baby chooses to go head down, then great. But if it doesn't, there's a deeper reason that we might not even understand or find out, but there's some reason that baby needs to be born in that way. So let's keep that in mind, okay, everybody? So I hope this conversation on breech is opening your awareness to understand more ways that you can support moms in when they have their babies or in those breech positions, and know that there's more to learn about how to help babies find a different position in the belly. And I look forward to sharing that with you in my new Pregnancy, Pain, and Beyond course. So be looking for that in May, okay? All right, everybody, thanks for listening in. Here is to smoother births and faster recoveries. Take care, everybody. See you in the next episode. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.